Single versus simultaneous bilateral knee replacement. What you need to know. Hey everyone, I am Dr. Shekhar, a joint replacement surgeon at Shekhar Hospital, Nagpur. I am here to talk about a question that is often asked during counseling by my patients and their relatives. That question is, should you get one knee replaced or both at the same time? Now I know it seems like getting it over with in one go might be tempting, right? Two birds, one stone. But hold on, it's not like changing tires on a car. We're talking about your body, a complex and interconnected system. Before we start, let me put to rest the fact that it is not mandatory to replace both the knees if you wish to opt for knee replacement. The important point is that if only one knee needs surgery and the other is doing fine, we should respect that and don't need to replace the second knee unnecessarily. So unlike in a car where all tires need to be changed after a certain mileage is achieved in humans, we should replace only that knee that needs surgery. So let's dive into this a bit deeper and see when it might make sense to tackle both knees together and when it's better to take a staged approach. There are some obvious advantages of simultaneous knee replacements in a single sitting. First off, you're only going under the knife, or rather, the scalpel, once. In one anesthesia, both the knees are done. That means one round of anesthesia, one recovery period in the hospital. Think about it. One less time dealing with pre-op nerves, a definite plus. Second, for all the patients with a job to take care of, it means only taking time off from work once. You can focus on healing and getting back on your feet without juggling multiple recovery periods. And finally, think about the physiotherapy. You're going to need it either way, right? But with both knees done together, you're streamlining and combining that process of recovery as you work on regaining your strength and mobility. The simultaneous knee thus saves both time and money for the patient. Now we discuss who is not a good candidate for a simultaneous knee replacement. So let us discuss the categories and factors where I avoid a simultaneous knee replacement and offer a safer staged approach. First factor to consider is the age of patient. I have set a cut-off age of 70 years. Some surgeons might have the cut-off age at 65 years or others at 75 years, and it may vary from surgeon to surgeon. So when it comes to simultaneous knee replacements, I usually do not advise it in patients over 70. As we get older, our bodies don't bounce back quite as quickly. As the age of the patient increases, they become more prone to complications, and the risk of needing to be readmitted to the hospital goes up. It's not that it can't be done safely, but we want to make sure we're not putting any unnecessary strain on the body. Next factor we consider is the cardiac status of the patient. If you've got a history of heart issues, maybe you've had a bypass, angioplasty, stenting, or you have reduced ejection fraction, meaning your heart's just not pumping as strongly as it used to. We've got to be extra careful. Simultaneous knee replacements put more stress on the cardiovascular system. So, if your heart's already working a little harder, we might want to consider staging the replacements to give your body a chance to recover fully between procedures. Another factor we consider is the health of your lungs. If you've got a condition like COPD or ILD, which affects your lung function, simultaneous knee replacements might not be the best option. These conditions can make it harder for your body to recover after surgery. Poor lung reserve combined with the drugs during anesthesia can reduce your respiratory drive, leading to complications. This may lead to a longer hospital stay, potentially even some time in the ICU. By staging the procedure, we reduce the stress on the lungs and reduce the risk of these complications. The next important factor to consider is presence of renal or liver disease. If you're dealing with any kidney or liver issues, we need to be extra cautious with simultaneous knee replacements. These organs play a vital role in filtering waste products from your blood. in the presence of renal disease and putting them through 2 major surgeries at once, we can put a real strain on them. In this case, the patient might end up requiring dialysis, as it is unable to bear the strain of change in hemodynamics. Next factor is any history of DVT or pulmonary embolism. If you've ever had a deep vein thrombosis or a pulmonary embolism, that's something we need to take very seriously. These conditions mean you're more prone to development of blood clots in veins, and major surgery like a knee replacement, unfortunately, increases that risk. We at Shaker Hospital reduce the risk of clotting by choosing staged knee replacement, early mobilization, and use of anticoagulants, and safely give wonderful results. Next important factor to consider is very long-standing diabetes. Now, diabetes is something I see a lot in my practice, and we at Shaker Hospital can safely do procedures with no added complications. However, in case of decade-long diabetes, subtle subclinical damage occur to vessels, heart and kidneys. It's a condition that can affect multiple systems in the body over time. If you've been living with diabetes for a while, it's important to know that it can sometimes lead to subtle heart and kidney problems. So, when we're considering simultaneous knee replacements, we want to be extra cautious. That much stress on the body from a double surgery could potentially tip the scales and lead to complications. Last but not least, let's talk about obesity. If you have a higher BMI, meaning BMI over 35, it can make things a bit trickier. Morbid obesity, that is BMI over 35, can make mobilization after surgery more difficult, increase the risk of DVT and infection, and generally make recovery a bit tougher. That's why, in morbidly obese cases, we recommend a staged approach to knee replacements for patients. Many a times a bariatric surgery may be indicated before knee replacement, especially in cases with BMI over 40. So, there you have it, the ins and outs of single versus simultaneous knee replacements. The bottom line is this: it's not a one-size-fits-all decision. It's about finding the approach that's right for you, based on your individual health history and circumstances. And that's why it's so important to have an open and honest conversation with your surgeon. Remember, you're a partner in this journey, and together, we can get you back on your feet, feeling your best. This is Dr. L. Shekhar signing off. Leave your comments in comments section to let us know what else you would like to know.